Hello and welcome back to Regina Young and his iBoys Resource Center. So we're talking about nursing homes and things that are going on in the nursing home during coronavirus times. The question is, how a lot of people always say, well, I'm working, I get overwhelmed, I'm trying to take care of my loved one, but I can't, so I'm going to put them in a nursing home. So is it good to try to put them in a nursing home right now during coronavirus time? And will the nursing homes accept and take a new patient in during coronavirus times? We are watching PBS News Hour, and it's from April the 14th, 2020. And the gentleman is saying maybe it's not a good time for nursing homes to accept new people into the nursing home. Maybe they should stay where they are. That's what he believes. Let's see if he says exactly what I say. He says
these deaths, other states are doing nothing. And so that's the first source of this underreporting, is just that we have a lot of missing data. A lot of states aren't reporting, but then
he also believes that a lot of states are not reporting information. So by them not reporting the information, he's saying that we truly won't know the correct information about coronavirus because there's not enough information, not a lot of data. But everything that I've watched about coronavirus,
nursing homes have obviously locked down, no visitors
saying the same
allowed,
thing.
Right? They're barring all the communal activities too. Staff, of course, have to come and go. But what else could they be doing? Could they be banning new entries, new patients from coming into the facilities?
That's one step, and I think many facilities have stopped taking new patients from the hospital. So hospitals right now are looking to discharge COVID-positive patients to nursing homes. Many nursing homes have held the line and said, we can't currently safely care for these patients. So that's definitely one thing they can do to kind of try to keep those residents that are currently in the facility safe.
And what about when you...
So hospitals are trying to discharge the elderly people and put them in nursing homes. But the truth of the matter is, if they do that, nursing homes are shut down to the point where they're not allowing visitors. It used to be that one person, you could pick one person and come in, and the hospital same way. Only one person could come in and see you. But even the hospitals, they don't want you coming and going. If you're in, you're in. You're staying. They don't want you coming and going. They want you to stay in there. Which is understandable, and that's to slow down the risk of the coronavirus being spread and brought into the hospital, because there's already sick people there. So you put all of them in jeopardy if you're running in and out of the hospital. That's the same thing with nursing home. The people that are in the hospital, they're trying to come to the nursing home, have been in the hospital, and they are already proven to have the coronavirus. But yet, the hospital is saying, hey, y'all need to take these people. And nursing homes are saying no, because then that opens up our staff to the virus, as well as people that are already compromised with immune systems to coronavirus.
Look at sort of pre-pandemic, how nursing facilities and assisted care living facilities handled these kinds of things, that you had to believe there was a plan in place to handle infectious outbreaks, right?
Unfortunately, there really wasn't a plan in place. This has not been the strong suit of either nursing homes or assisted living. And unfortunately, I think it's easy right now to just blame the nursing homes and the assisted living facilities. I also think we have to point the finger at how we pay for these services and how we regulate these services. We've often underfunded nursing home services in this country. We've had poor models of oversight and accountability. And so at the end of the day, we kind of get what we pay for here, unfortunately.
And that's the sad thing about putting your loved ones in a nursing home. You never know what's going to go on or what's happening in a nursing home. I worked at a nursing home, and sometimes I would see some of the aides, because the nurses, they do their thing. Yeah, okay, they're with the patients, whatever, but, they kind of brush the patients off to the HHAs or the CNAs. So a lot of times a CNA might have anywhere from 8 to 14 patients a day. And they expect you to get 8 to 14 people up, dressed, fed for breakfast and lunch. If you're 7 a.m. to 3 p.m., you have breakfast and lunch and snack usually during that shift. And they expect you to get all 14 people dressed, bathed, and out the door. A lot of times, people in nursing homes don't get a full bath every day. Some might not get a bath at all. So just imagine during this coronavirus time and everybody's not getting a bath. That means they keep the same clothes on. And we all know that coronavirus can live on clothes for days, just like it can live on metal surfaces for so long and plastic surfaces for so long. A lot of the staff are underpaid, so I understand why they said nursing homes are underpaid. But a lot of people put their loved ones in the nursing home because they can't care for them, or they have family like kids and everything, and they're taking care of them, and the other person is an older person, and they just can't do it. So, you know, really, it's a lose-lose situation for the elderly people because they're in this nursing home, and if one person in that nursing home gets coronavirus, it's going to spread like a fire through the woods. It's going to go fast because they touch everything. They're in people's rooms. You have people on the dementia wing that be, how can I put, they get in other people's beds. They kiss people in the mouth that they don't know. They don't know what they're doing. Sometimes they get into doing sexual things. And it used to be that they would say, hey, y'all can't stop them from doing that. And then there was some daughters or sons or grandkids saying, yes, if you see my grandma making out with so-and-so, I want you to stop it. So during the coronavirus times, it's just like the nursing homes that had a guy that had herpes, unfortunately, and he slept with, or he was kissing and doing all kind of things on these women, and it was like an outbreak of like 10 to 15 people that got herpes, and the families was suing the nursing home because they felt like, hey, the staff should have intervened and stepped in. So are people going to try to sue the nursing home because a loved one die or get Corona-19, the virus? Or what are they going to do about it? Because he's saying that really there's no safety precautions. They didn't think about this. They didn't have it planned. And really, they're not prepared for it at all. A lot of places are not even prepared. Not even hospitals.
A lot of families out there have loved ones in these facilities. They're reading the headlines and they're worried. I want you to speak directly to them and tell them what you would advise at this point. But should people be pulling loved ones out of their facilities? Conversely, should they think twice before moving someone into a facility right now?
Yeah, first of all, my heart goes out to everyone with a loved one in a nursing home. This is an incredibly trying time. I don't know that many of us can pull our loved ones out of a facility at this point. I think it may be too late, actually. As we were just discussing, the virus is already in a number of nursing homes around the country. If you do bring them into your house, you have to keep your loved ones safe. Are you able to sort of have a high level of infection control to keep the virus out of your home? And then finally, remember, there was a reason they were in this nursing home to begin with. They need lots of assistance with activities of daily living like bathing and dressing. Are you and your family going to be able to provide those sets of services? You could potentially hire somebody into your home, but then you're facing the same set of challenges you might have faced in the nursing home with staff bringing it into your house. So I very much like the idea of pulling a family member out of a nursing home, but in practice, I just don't know how feasible it is for most families.
Well, it is possible because in the state of Delaware and a lot of other states, you could actually bring your loved one home and you could care for them yourself. The only issue is if you do that, you have to make sure they don't have coronavirus because once you bring them into your home, you run the risk of affecting everybody else in your home. So you will have to put them somewhere where you can keep them safe and quarantine them for at least 14 days to assure that if they have any symptoms that they pass through and they're safe to be in your home. But in Delaware, there is a program where a lot of people go through, which is DDDS. And I'm going to do a live video about that to let you know more about that. That actually allows you to get funding for respite for your loved one, as well as Eastern Sales, which allows you to get paid for taking care of your loved one. A lot of grandkids take care of their grandma, and they work from home, and they get paid for taking care of their loved one. I think every state should make that legal, where they pay a family member to take care of their loved one. It's cheaper than a nursing home. So I don't understand why the state went and do it. They should make it legal where your granddaughter could take care of their grandma.